you to our sign up page. I already have an Charm account, so it's going to go ahead and ask me to access it. Once you're signed up for a Charm account, you will see this home screen. You'll see now, due to the recent developments in the COVID-19 crisis, we have put the Enable Telehealth button right here. You can see right now, if you hover, we are giving free telehealth to everybody until July 2020. So you will have a few free months of telehealth and will not be charged. The cost of telehealth is $20 per month per provider after July, starting in July. We want to make sure that everybody has access to telehealth during this time. So all you need to do is click on that Enable Telehealth, and it will give you a brief description of the pricing. You can read and accept the terms and click subscribe. And you can see here, you could choose your profession, choose your state, and update your license number, or upload your state medical license and click save. And then you will be activated. Right now, we do have a dedicated team to activate these requests the same day. So you can start your telehealth subscription. You will not be charged until July, and you will be activated the same day. Now, in terms of starting a telehealth visit, once you are enabled, you'll see that if you go to your calendar and go to a day view, you can go ahead and book an appointment. So if you click, you'll see that the video consult mode has now appeared. That will be your telehealth visit. So you can search or add a patient, click the video consult button, and you have two options. Right now, I'm going to say direct connect. This is when the patient joins the session from the patient portal or using the telehealth invitation link. So I'll go ahead and select that and click confirm. And now when you go to your list view, you can scroll down to the appointment that we created just now at 12:15. Now, when you do set up a telehealth visit for a patient, there are three ways that they can join. One of them will be through the patient portal. One of them will be through the confirmation email that they receive. And the other is through direct messaging through you. So you can click this join URL link and it will generate this link. You can share this by any means that you have. Also, you can use this to share if for some reason a patient wants somebody else to sit in on the meeting, you can invite multiple people by sharing this URL. Now on the patient side, if they go to the patient portal, you'll see here, when they go, they will be able to check in. When they click the join URL, it will bring them to the join screen through Zoom. It will autofill their name and their email based on what they've configured in their patient portal. And when they click join, it will launch Zoom, much like you did when you joined this webinar. So now this is going to load and it's going to try to launch Zoom, and it's going to give me an error saying that I'm already in a meeting. It would just launch Zoom normally. Also, if you send them an email, this is the email they receive. This can be customized. So if you would like to offer further instructions, you can customize this, and you'll see this will be the same join URL that you can share from your calendar will be in the body of this email. When they click on this, however, their attendee's name and email address will not be auto-populated, but they can just fill that in and click join, and it will launch Zoom. Now, going back to the practice side. In order to start the telehealth visit, you will need to create an encounter. An encounter is essentially just a chart note, and you could do so by going to the patient's file. However, today I will go and do it from the list view. So you'll see here, if I go to our booked appointment, over on the right, it'll say encounter. If I click start, you can choose your chart note type and click create. And then it will bring you to your chart note. Now, we do have a basic webinar that we do hold that goes over all of the configurations of the templates. I will not be going over that today. This is purely for telehealth. But if you are interested, please reach out. We do have videos of that we can share with you. Now, once you're in your chart note, you can see you'll have a video consult button up here next to the save button. If you click that, it will make sure that you have a valid license in the patient's current state of residence. You can click yes, and then there will be a healthcare provider responsibilities page. And you'll just go ahead and click I agree, and then it will launch Zoom. The patients that do not have Zoom will be prompted, like I just was, to download Zoom. So Zoom is also compatible with Macintosh computers, iPhones, Androids, and Windows computers. So regardless of the device they have or the platform they're on, they will be able to download Zoom and use it. And that is pretty much it in terms of launching a telehealth. You can see that it's a very simple process, and it's very straightforward. Zoom does make the whole thing very streamlined. And so next, I will go over our COVID-19 templates. So if you go to your settings page, and under templates, you can select the Charm library. And what you can do is just go ahead and select all as your template type, and you can just search COVID, and you'll see everything that pops up. So we do have template types for instructions, symptoms, diagnosis, lab records, instructions, multiple instructions. This is the quarantine guidance, the question and answer, and treatment notes, and the treatment notes / instructions. So you can view these and also import these into your account so that you can use them in your chart notes. Also, I believe, let's see if we have any questionnaires. So we do have COVID screening forms. So what you can do is send these screening forms as questionnaires to your patients. They can fill these out so you better understand what you're going to be dealing with when you come to your telehealth visit. Now, as I said, the telehealth you will not be charged for telehealth until July. So it is free for everybody until then. So please do sign up, and we will get you activated same day. Now, we can offer other add-ons for your practice if you do decide to use us in addition to your telehealth. So we do have telehealth here. We do have electronic prescriptions and controlled substances if you need that. We have lab integrations, immunization registry, the prescription monitoring program. We do have the AAP Bright Futures templates. And now for your practice management, this may be more applicable to your telehealth, but we do have the Bluefin payment gateway. And with the Bluefin payment gateway, it will allow you to take payments online. So because, telehealth visits, usually people would like those to be prepaid. What you can do is configure a web embed calendar in your settings. And with Bluefin, first you can add this to your website. So patients can go and book their appointments online via your website. This works for new and existing patients. And in the online appointment options, you can enable card processing. Now, what this allows you to do, if you do have Bluefin enabled, you can store their card on file, you can charge them, or you can charge and store their card on file. And you can charge a fixed rate or based on the visit type. So when you do configure your visit types, you can associate a charge with this, and that will allow patients to book online. Now, what you can do is create specific visit types, and with those visit types, you can actually attach your questionnaires specifically to those visit types. So if you add a visit type, you can select a provider, or don't select for all, then you can do a new patient telehealth visit, and you can select the questionnaires you would like to send to them. So with this setup, you can have a pre-screening form. The patients can go to your website, go to the web embed calendar. They can add themselves to your patient list. They can book an appointment. You can charge them for that appointment. And once the appointment is confirmed, they will receive an email welcoming them to your practice. They will receive one that will allow them to set up a patient portal. They'll also receive a third email letting them know that they have questionnaires to fill out in the portal. So without interacting with the patient at all, they can go book an appointment, pay for that appointment, set up a patient portal, and fill out all the questionnaires you need to be ready for the appointment automatically. We also do have some other add-ons. We have text and voice notifications. So in addition to the email notifications you'll get, we will have, you can send text and voice notifications as well as appointment reminders. If you do need fax, we have electronic fax. We have a scanner integration. If you are going to be uploading a lot of paper charts. And then we also have e-claims. So if you do bill to insurance, we are integrated with Optum Clearinghouse, and that will allow you to generate claims and send them directly to the clearinghouse via Charm. Your ERAs and EOBs will appear in your billing section and will map to the claims automatically. We do also have some other, we have RCM service where we essentially act as your biller. We do have full script integration, e-commerce. If you do sell products to your patients, you can sell them through the patient portal. This also requires Bluefin. We have Charm Connect, which is a direct HIPAA compliant secure instant messaging platform. And we do offer integration with external devices. We have direct messaging with other providers on the Direct ID platform. We do have a QuickBooks integration, and we also have a custom branded app. So that is essentially how you can set up your telehealth. An additional thing is if you plan on using this specifically for telehealth and you aren't going to be using this as a full EHR, what you can do is click this More button down here on the left-hand side and click Customize. What this allows you to do is turn off the areas of Charm that you will not be using. So you can limit it specifically to your calendar, your chart notes, and your patient list. If you have other means to run your practice. And you can see when you turn all these off and simplify, you can also rearrange these. And you click Save, and you'll now see that you are streamlined for telehealth. So now I believe we will open up for questions. I see that a number of questions have been answered, and I will move over to these ones. So is this webinar going to cover what codes go into the bills, how to bill a telehealth therapy appointment? So when it comes to billing, And let me go ahead and enable this. And as I said before, we do have an extensive onboarding webinar. It's a little over an hour, and that does go over all the basics. I will cover it now, but just in the future, if you'd like to see that. So let me go ahead and turn on billing and click save. So in terms of billing, what you could do is navigate to your settings, and under billing, you'll add your procedure codes. So what you can do is add the procedure codes here. All of the telehealth procedure codes, they're available online. So if you just do a quick search, you can find all of the acceptable procedure codes. You can put the code in the description, your charge, the category, modifiers, place of service, et cetera, et cetera. Now, when you are in a chart note, you'll add the DX codes here. The diagnosis codes will need to be added. Let's see if they updated it. Nope. I need to search the actual DX code so I can actually add the template that we have. But you'll need to add the diagnosis codes inside the encounter, and then you'll see the procedure codes here can be added. So they can be added in the encounter, or you can actually add them when you're generating the invoice. The only thing that's required in the chart note is the diagnosis codes. So I'm actually going to go over here, and let's go to the Charm library. And let's go ahead and search COVID again. And diagnosis codes we can import. And now when I do refresh, now I can scroll down to the diagnosis code section, click templates, and I scroll through my templates. And the COVID-19 diagnosis codes are here. So you can check these off, click add, and they will be added into your diagnosis section. And then you can see the procedure codes. If I do add a procedure code, you can see the diagnosis pointers will populate automatically. If you do need to change that, you can click on the blue DX, rearrange these. You can uncheck the ones that don't apply, and you can also add modifiers and change your place of service. So I'm just jumping back. Well, and then actually, let me go ahead and follow through. What you could do here is you will generate, this is in the billing section. You can go to the generate bill section, select new invoice. And let's see, this is the wrong one. Cancel, let's go down. So the invoice was already generated from this encounter. So we can't update it from here, but when you are in the invoice, you can also view the diagnosis codes from here. And you can also add additional billing codes. So you can add your billing codes when you're generating the invoice, or you can do it from within the encounter. If the patient has prepaid, there will be a yellow box here that says, this patient has X amount of dollars in unpaid credits. Will you like to apply this to the invoice? Check that off, and it will apply what they prepaid to the invoice, and then it will balance out the outstanding balance. So I'm just going to jump to, and I see that they've all been answered, or they're marked answered by our team, but I'll just go over them in case everybody watching has not taken the chance to read. Shannon says, if not using Charm Calendar, sadly it won't link on my website properly. Please give a call to our support. Each and every website builder is different, and there are little tricks to get them to work. So we can help you get that set up and figured out. So how do I have a patient pay? I have Bluefin set up post-appointment. So what you can do to get a patient to pay post-appointment is, once Bluefin is enabled, you can go to your invoices, check off the invoice here, and select Send Invoice. Now, when you're sending an invoice to a patient, you can send it to their PHR account, or you can send it via email. If you do send it via email, you'll see that it will be password protected based on their last name and their date of birth. And you'll see here for the email, you can select Enable Online Payment. That will send them a payment link that they can click on and pay. If you send it via PHR, just check off the Allow Payment through PHR. They will be able to enter their card information and pay you that way. So Lauren's asking, you missed the first 10 minutes. Where can I get a replay? We will be posting this. It is being recorded, and we will send out a link to our attendees list. So keep an eye out for an email. We will share this video with you. So Diane, it's asking you for a credit card. That is correct. You'll need to put a credit card on file. However, you will not be charged until July. Emily, I did go over what codes go to bill. You'll need to just search online. They're readily available for you. So to cancel telehealth, all you need to do is email support@charmhealth.com and let them know you'll no longer be needing it. Or if you're in your Charm account, you can go ahead and click the help button, which is the question mark in the circle, and just select support, and that will send a ticket directly to support@charmhealth.com. I would recommend doing it this way because we can see that it came directly from the email associated with your Charm account. If it is from another email, most likely we'll want a confirmation from the email that is associated with the Charm account. Is Zoom HIPAA compliant? So Zoom is HIPAA compliant. The version that we have is HIPAA compliant. It blocks people from sharing files inside of Charm. Now, Zoom does have a non-HIPAA compliant version. I believe that they are offering that right now. This is a modified version of Zoom that is HIPAA compliant. And I believe it's just the ability to share files that are not secure. So everything that is non-HIPAA compliant about Zoom has been disabled through the telehealth subscription that you get through Charm. So what is the cost of added text messaging? So we can actually navigate to our pricing page. And this is, you can find this at the top of charmhealth.com. And if you scroll down, you'll see that text messaging is $20 a month for the first 250 text messages and 8 cents for each additional. You can turn on and off which specific text messages you'd like to go out. So you can limit it to confirmation emails or reminders if you'd like. Also, if you do the per provider plan, those are bumped up. It will be included and you'll get $2,000 a month per provider. Is there a limit to the number of telehealth visits per month per provider? No, there is not. So it is unlimited. You can do as many as you want. You'll just know that the accounts are limited to one provider. It is not a shared account for the practice. So you will need to be signed into that particular provider's account to use telehealth. Is there a procedure code for a telehealth visit? That would be something to just search. So there is, if you just do telehealth CPT codes, you can see that they are readily available. Now, if you were, I'm sure that there are more specialized telehealth codes. So I would just research that and see which ones you need. But you can find a list of the CPT codes online. So what is the fee to activate Bluefin payments? So there is no fee that you'll pay to Charm for Bluefin. You'll need to pay Bluefin directly. I will share the contact email for our rep over at Bluefin. You can, and let me see, I'll just type that answer into the chat. But it is for, let's see all that. It is M. Thompson at bluefin.com. So I just sent that into the chat if you'd like to copy that, but you could reach out to Bluefin and they will discuss, you can ask them all other questions about pricing and contracts and things like that. But it is comparable to other processors. So I have a Charm Tracker account currently not using PHR. How do I set this up that I can send PHR invites to clients? So to send PHR invites, there are a few different ways. You can, so anytime you send a questionnaire to a patient and they do not have a PHR set up, they will automatically receive an invitation. So if you start using questionnaires, you won't need to manually invite each patient. Now you can go to the patient's file, go to the patient details section, and you'll see right here, PHR registration, and you can just click the send invitation button. Another way, if you go to your analytics section, you can scroll down to where it says PHR usage, and it will give you a pie chart of who's using it, who's not. If you click the orange section, it will give you a list of all your patients with the invite link here. Also, if you are just getting started out, you can go to settings and under patient registration, if you check off PHR invitation required, go ahead and set that to yes and save. Any patient you add to your practice will automatically receive an invitation link. Can you set up so each person pays their co-pays before the visit? So there really isn't a way to do this from the calendar. The calendar is going to be based on a flat rate or the visit type. However, after the fact, what you can do is when a patient fills out their insurance information, and which we do have a widget for, so you can have it set up so they receive a questionnaire with their insurance information widget. In that questionnaire, they will fill out that information. You can view their questionnaires and there will be a reconcile button. When you click that, it will populate the insurance into their information. And if they filled out their copay, the system will know their copay. And so when you add a payment to an invoice, you can check off pay copay, and that amount will be pulled from their insurance information they filled out. So that's a way that you can have them pay their copay. Unfortunately, there is no way to have that information readily available when they're booking online prior to the appointment. What I would recommend is if you have an idea generally what a copay could be, you could set a flat rate so that they pay, for instance, $50. Now, what you can do is they would prepay for that $50. You could then, at the end of the visit, when you generate the invoice and actually populate their copay information, you can apply what their copay payment is, and if they owe more, you can send the invoice to them. You can use, if you've saved their card on file, you can charge the additional amount, or you can refund what they don't owe you and then send it off to insurance. So can you integrate patient intake directly into the chart note? So there is no way to automatically do it. However, you'll see when you're in a chart note, there is a questionnaire section right here. So let me see if I just go ahead and add one. So we can, if we pretend that this is filled out, you can essentially go to your chart note, jump over to the questionnaire section, select the questionnaire, and then click copy, and it will allow you to quickly copy the entire thing, or you can scroll through and select what you'd like, copy, jump over back to the chart note, and then paste right into the chart note. So do I need to set it up on the back end that I can send PHR invites? So I did go over that. You can go to settings, patient registration, and set this to no. That will disable automatic invitations, and you'll need to manually invite them. So no, I cannot send them from the patient details page. There is no PHR info or link or checkboxes that I can see. So if you're talking about a patient's file, patient details, PHR registration, and you click send invitation. Now this should appear there. So if you do not see this, please contact support and we will work with you directly. We can screen share and figure out what could be the issue, but it should be. How long should a telehealth visit be, or does it depend on the payer? So for the telehealth visit, I mean, that would just depend on your practice. I do know that there are different codes for different lengths. So that is just determined by the practice, the patient, and I would look into your payers. You could see sort of the reimbursement rates for the different CPT codes that you could submit. Those CPT codes will be associated with a telehealth visit length, and then you can decide moving forward what length that works best for you. Oh, I'm sorry, Colleen. Did my question get skipped? I want to know how to generate the Zoom URL link if I don't use the Charm calendar. So you will need to at least enter in the calendar here. So let's see, if you did not use the Charm calendar, I believe the best way to do that would be to utilize Zoom. So once you start the, well, yeah, if you're not going to be using this calendar and you don't want to just add it really quickly to get the list view, I believe what the best way to do that would be if you go and start an encounter. So you can go to your patient, you can go to the encounter section and click plus encounter, or you can click this plus button up here and select encounter. I'm going to select no, I want to start a new encounter. You can select video consult and click create. It will launch the meeting. You can click this and join Zoom. In the actual Zoom system, in the Zoom program, there is an invite button. And if you click on that invite button, you can either copy the URL, copy the entire invitation, or you can, there's an area where you can type in their email and it will just email them the invitation. So you would do that through Zoom. All right. Is there any way to automatically have a super bill created and sent to the PHR after the encounter is signed? As of right now, that is not available. I know that that feature request has been sent in. So I will go ahead and put another request in for that. We have had a lot of requests. So I think that may be available in future updates, but currently that is not available. What will the patient see when they are sent the join Zoom meeting? So I did go over this earlier, but in the patient portal, they can go to their upcoming appointments and click check in. This will bring them to here. Oops. It will check in, and then they will see this. When they click join, it will load, and I believe it will go ahead and launch. And once it launches, they will just see what, you know, a box will pop up, and it will either have your name or it will have your camera if you're sharing a camera. So it will just automatically launch Zoom for them. If they don't go through the patient portal, it'll ask them to type in their attendee's name and the email address. If you have not joined the meeting yet, it will just have a loading circle and will say waiting for host to start the meeting. So let me see. So yeah, can chart notes be taken? Yes. So with Zoom, if you minimize it, it will have a small window here, and then you can also split screen via Zoom and Charm, so you can take chart notes while you can do it. Are the meetings recorded? Not automatically. So Zoom does have the ability to record. So when you're in Zoom, you'll just hit the record button. I believe down on the bottom, if you don't see the red dot on your window, if you click the 3 dots that says more, there should be a record option, and then those will be saved onto your computer. And then you can also just save the audio, and then you can upload those into the document section of the patient. Or what you can also do is allow for the patient to record it. And so you can just go to the patient's name in the participants list, click the 3 dots, select allow record, and that way, you know, if you don't want to deal with sending the video over, you can just allow the patient to record it themselves so they have it immediately. So how do you split the screen? So Zoom is going to be in its own screen, just like you're using it right now. If you minimize it, this will appear small on your, let's see, it will float around in its own window. If you click the minimize button, it will show up in a little small window, or you can resize it depending on your system. So where are the 3 dots to allow the patient to record the session? So I believe if you go to participants, and then if you hover over a participant, you should see, well, I guess it's not 3 dots. I believe it'll say more and then an arrow. Participants should be along the bottom. So if you don't see participants, it should say more. Yes, recording the sessions are optional. So I don't believe that you're required to record and save. That's something you can look into depending on your state's laws, but I've never heard anything that that you need to record sessions. So if you log into Zoom, you should see recordings. So when it comes to recordings, you will go into your Zoom settings and set a folder for your recordings to be saved. So you can designate a folder on your device, and then when you record, the files for the recording will be downloaded into that folder. And again, participants should be on the toolbar of your Zoom account. So if you may not see it now, it's because you're not the host of the meeting. When you're a host, the options change. So you will log in. If we don't have full access to Zoom, what do we log in with? You will log in to Charm, and you will launch Zoom through a chart note. When you click on that, you will have access to Zoom, and you could use their invite section there to send invites to patients. So are patients able to record meetings as well as the physician? Yes, they can. You will need to go in. This is on a per patient visit. So each visit by visit, you will need to go into the options of that visit, click on the patient and say allow record. So you'll need to allow the patient each time to record. Can patients opt out of the recording? Usually the recording of sessions are because the patient requests that. So I don't think you're required to record. It's just an option that you have. You can offer that to patients, or you can't, or you don't need to. So in terms of, if you prefer to record it, I would recommend sending them a consent form via the questionnaire section that they can fill out to give you consent to record the session. So yeah, yeah, Jake, that is a good, yeah, that's a good thing. I believe if you download, yeah, that's right, where the recordings are stored. I will need to get back to you on that. That's a great question. I did not consider that. I believe when you do record it, it'll probably be in it will be in the Zoom files. So if you go to your computer and find where Zoom is saved, there will be a folder that says recordings. So yeah, you are correct. You won't be able to change the destination folder for those video downloads, but I do know the default, and that's the one that I use. It is in the Zoom, where all the Zoom program files are. There is a file that says recordings. No, the video will be saved locally on your hard drive. It is not attached to the chart note. So if you would like to save them, you will need to upload them into the patient's documents section under a folder that you create. The best way to have patients send photos of rashes, etc., that would be through the patient portal. So what they can do is if they go to the patient portal, they can upload and go to documents. And what they can do is just select upload, and it will launch the screen, and then they can select the photos and then upload them that way. They will then appear in the patient's file. So you will receive a notification here letting them know, and you can view all the documents that patients have sent you, or if you go to the patient themselves, you can go to their documents and it will appear here as documents that are shared with you. So I'm not sure. I can, when it comes to showing you how to generate a Zoom link, if you don't use the Charm Calendar, unfortunately, the way Zoom works, it does hide my settings from you. So if you launch a Zoom meeting, there will be an invite button along the bottom. And when you click that invite, it will give you options whether you want to directly email them or you could just copy the URL. Unfortunately, when I share my screen with you, the way Zoom works, it hides that taskbar from you. So there's no way I could really show you this. We can, if you are interested, you can reach out to support and we can send you screenshots of that. But yeah, just how it operates now, there's no way I can actually show you my Zoom options while I share screen. It automatically hides those. All right. So we're still getting. Thank you, Jake. I appreciate that. All right. Well, it looks like the questions are slowing down. I'll give everybody an opportunity to ask your final questions. So we will hold on for just a minute to see if there's any more questions. And if there are not, then we will conclude the webinar. As I said, we will be offering a recording of this, and I believe the plan will be to upload it onto YouTube. And we will send follow-up emails to everybody that attended today, and I'll ask them to include the link in that email so that you can view this again if you'd like. Oh, let's see here. Question a few minutes ago about questionnaires not opening from the calendar list view. So when you mean, can you elaborate on what you mean by opening? Do you mean you would like to view them, or do you mean send them? So if we go to the calendar, we go to the list view. Oh, you know what? I'm on the wrong account. Let me jump back here. So yeah, click here to questionnaires. When it says no data available, what that means is they have not submitted the questionnaires you've sent. And this is going to be questionnaires that are directly associated with this specific visit. So you won't be able to view their previous chart notes from this area. And when it comes to face sheet, you know, it will bring you to their face sheet. And you can see here, if you go to questionnaires, I don't believe this one has any, but if you go to questionnaires, yeah, there's none here filled out. But yeah, from here it will list the questionnaires that it will pull up what they filled out on the questionnaires that you sent specifically to this visit. So, so if a provider chooses to enable telehealth, will it be automatically selected? So what you can do is it will be pre-select in person. However, if you configure the visit type, so it would be video consult. So you would just go to settings, you would go to your visit types. And then when you add a visit type, you can type in a name and then select the mode. So if, and then the duration and the charge and the color and everything like that. So that would help you in terms of booking an appointment. If you don't want to configure all of this, you can just select the visit type and then it will do everything for you. All right, I'll just go ahead and throw out a last call for questions. If anybody has any more questions, now would be the time to do so. And I'll give you about 30 seconds before I conclude. All right, we are available. So for when it comes to any questions that you have, and thank you, Sherry, for asking that question. So when it comes to support, and if you have any other questions, if you go to charmhealth.com, you'll see in the bottom right corner, after a few moments, you'll see a live chat bubble will pop up. We do have support agents available to answer any questions via chat. That is 9 to 5 Pacific time. Also, if you scroll all the way down to the bottom, you can click company, contact us. This is our phone number, 1-855-571-5557. That is the number to our support line. These same people in live chat will be answering support calls. If you prefer speaking over the phone rather than typing, they will be happy to answer any of the questions that you have. Also, and again, that is 9 to 5 Pacific time, Monday through Friday. We do have product support. You can email directly to support@charmhealth.com. And for general inquiries, you can email info@charmhealth.com. The response times for that are usually 24 hours, whereas you can call or chat are open 9 to 5. So these are available 24/7 for submissions. However, the wait time is a bit longer than the actual live chat and calls. So that's who you can direct all of your additional questions to. Also, if you do have a sales rep, you can call them or contact them to help you out getting set up. If you do sign up for a new account, you usually will receive a welcome email from them, and they will get you onboarded. All right. Well, thank you all for joining us today. I hope this was informative to you. Please take advantage of all of our options, and have a great rest of your day. Have a great weekend, and please stay safe out there. Keep your social distancing. All right. Goodbye, everybody.